The purpose of this presentation is to ensure that there is clarity around each question to calibrate members within the teams of each province. The aim of this oral health component of the NDIS study is to determine the association between nutritional related factors such as sugar intake, caries risk factors such as brushing frequency, and oral health status among children, adolescents, adults, and the aged. The objectives of the study is to determine the relationship between nutritional status, oral health practice, and oral health status amongst children aged 0 to 23 months, children aged 2 to 5 years, adolescents aged 4 to 18 years, adults aged 18 to 59 years, and adults aged 60 to 75 years. Data will be collected by administering questionnaires to participants, and the participants could be the parent or caregiver, the adolescent or adult, depending on the age group. And questionnaires will be administered to the various age group categories as discussed in the previous slide. So the questionnaire 1 is for infants between the ages of 0 to 23 months. If there are a few questions, question 1 is, does your child visit the dentist or dental clinic, yes or no? This question refers to if a child has visited a dentist for pain or a dental checkup. If they answered no, you can skip to question 5. However, if they answered yes, you'd want to know how far is the dentist or dental clinic from the home? A, within walking distance, or B, they have to take a car, taxi, or bus to get to the dentist or dental clinic. The distance from the participant's home address to the nearest public or private dental facility, can be it at a remote clinic or day hospital, is required. We want to know how accessible the dental facilities are to the home of the participant. If answered yes to question 1, then you'll ask question 3. Is the dentist at a government clinic, yes or no? A clinic is a no-fee treatment facility which can be a mobile, or it can be offered by dental faculties or even by the day hospitals in South Africa. If answered yes to question 1, then we'll ask question 4. For what reason did your child visit the dental clinic? A, for routine checkups, or B, only when in pain? As in question 1, if the participant was seen by a dentist, provide a reason for the dental visit. A routine checkup is where a dentist fills in the road to health chart or advice is given on how to take care of the participant's teeth. The dental visit could be to extract teeth because of dental pain. So we need to distinguish what the reason was for the dental visit. Question 5. Does your child have any decayed or rotten teeth? Yes or no? This question is a self-reported assessment on whether the participant had any holes, dark spots on the upper front teeth or the back molars, top or bottom. For the front teeth in the top jaw, the caregiver will lift the lip of the participants for the dental caries to be observed, if there is any. Only one decayed tooth in the whole mouth needs to be observed for this question to be answered as yes. Still with age group 0 to 23 months, the next question is on pain. So this refers to if the child is experiencing dental pain due to rotten or carious teeth. This question is specific to children under the age of 5. So we'll be asking 6 questions, and they need to answer yes or no to the following 6 questions. Does your child bite with their back teeth instead of their front teeth? Does your child put away something nice to eat? Does your child cry during meal times? Does your child have problems with chewing? Does your child chew only on one side? Does your child reach for the cheek while eating? The next question is question 7. Did you provide any medication or home remedy as a form of pain relief? Ever. By medication, we mean any over-the-counter medication, any natural or herbal formulations used to treat pain, such as Panado, Brufen, Mybulan, Tylenol, aspirin, Disprin, cloves, and Nalkis. So we just need to know if they used any medication, if they experience any pain. Has the child had any teeth extracted as a result of tooth decay? By tooth decay, we also mean pain. If the child has experienced sleepless nights or any of the above symptoms listed in 6, and they had an extraction because of the pain or inability to chew, We want to know whether the tooth was taken out by a dental professional, not just the removal of a loose baby tooth with fingers, which is very unlikely in this age group. Question 9. What do you use to clean your child's teeth? A toothbrush, misquack, cloth, or nothing? If you answered D, nothing, then skip to question 11. But in question 9, does the mother or father or caregiver brush the child's teeth? It is not expected that the child brush their own teeth before the age of 8. Supervised toothbrushing is recommended until the age of 8. Question 10. How many times is the child's teeth brushed or cleaned? Once a day, twice a day, a few times a week, or never? Irrespective of whether the child uses a toothpaste or cloth, misquack, or any other form of cleaning, we want to know if the plaque removal occurs daily in the morning or evening and can be recorded as once a day. If the caregiver brushes or wipes the child's teeth twice a day in the morning or afternoon or evening or maybe after meals, it should be recorded as twice a day, even if it is more than twice a day. If the teeth are brushed every other day or not regularly every day, then it should be recorded as a few times a week, else it should be recorded as never. Question 11. Do you use toothpaste on your child's teeth? Yes or no? This is a particular question on toothpaste usage in children. If question 10 was recorded as never, then this question is not answered, irrespective if they use a brush or cloth to clean the children's teeth. This question relates to toothpaste usage of the caregiver on the child's teeth. Question 12. Which of the following will prevent tooth decay? Brushing teeth on a daily basis? Yes or no? Not snacking on sweetened foods throughout the day? Yes or no? Using toothpaste? Yes or no? Using a face cloth to clean the teeth? Yes or no? Drinking water frequently? Yes or no? This question relates to knowledge of the caregiver, and the facilitator should not lead the caregiver to the correct answer. Answer yes or no for each of the questions from A to E. Question 13. What causes tooth decay? Sleeping with a bottle? Yes or no? Placing sugar in a bottle? Yes or no? On-demand feeding, especially at night? Yes or no? Not cleaning your child's mouth? Yes or no? This question relates to knowledge of the caregiver, and the facilitator should not lead the caregiver to the correct answer. Answer yes or no to each of the questions from A to D. We are now going to ask questions for children between the ages of 2 and 5. Some of these questions are very similar to questionnaire for the infants between 0 to 23 months. So please bear with me. Question 1. Does a child visit the dentist or dental clinic? This refers to if a child has ever visited a dentist or dental clinic for dental pain. If the answer no, skip to question 5. Question 2. If you answered yes to question 1, how far is this dentist or dental clinic from your home? Within walking distance, or do they have to take transport to get to the dentist or dental clinic? The distance from the participant's home address to the nearest dental public facility is required. Question 3. If answered yes to question 1, for what reason did you visit the dental clinic? For routine checkups or only when in pain? As in question 1, the participant was seen by a dentist has to provide a reason for the dental visit. A routine checkup where a dentist fills in the road to health chart or has given advice on how to take care of the participant's teeth. The dental visit could be to extract teeth because of dental pain. The government facility is a place where there's no fee treatment. So even a dental mobile facility, example, the fellow pepper train, or dental faculties at in South Africa, or dental clinic at the primary healthcare center will be eligible for this question. Question 4. If answered yes to question 1, the dentist at a government is the dentist at a government clinic, yes or no? This question 5 refers to whether the child has any decayed or rotten teeth. This is a self-reported assessment on whether the participant has any holes or dark spots in the upper front teeth or back molars, top or bottom. This is the picture of various forms of dental decay. One of the more common dental decay presentations is on the front teeth, normally where the teeth become rotten under the front lip, top lip, because of using bottles and sleeping with bottles or falling asleep on the breast without proper brushing of the teeth. For the front teeth and the top jaw, the caregiver will lift the lip of the participant for the dental caries to be observed. Please be aware that we will not be lifting the lip up ourselves. We will be asking the participant's caregiver or parent to lift the lip up so that they can observe for themselves whether their child has any of the following holes, discolorations in their mouth. Only one tooth in the whole mouth needs to be observed for this question to be answered yes. Question 6. This is the pain questionnaire. We would ask the caregiver the following questions. Does your child bite with their back teeth instead of their front teeth? Does your child put away something nice to eat? Does your child cry during meal times? Does your child have problems with chewing? Does your child chew only on one side? Does your child reach for their cheek while eating? This question refers to if the child is experiencing dental pain due to rotten or carious teeth. Question 7. Did you provide any medication or home remedy as a form of pain relief? By medication, we mean any of the over-the-counter medications, any natural or herbal formulations used to treat pain, such as Panado, Brufen, Mylan, Tylenol, aspirin, or Disprin, or Grandpa, cloves, or Nalkis. Question number 8. Has the child had any teeth extracted as a result of tooth decay? Yes or no? By tooth decay, we also mean pain. If the child has experienced sleepless nights or any of the above symptoms listed in number 6, and they had an extraction because of the pain or inability to chew, was a tooth taken out by a dental professional, not the removal of a loose baby tooth with fingers? Question 9. What do you use to clean your child's teeth? A. Toothbrush. B. Miswak. Miswak, I don't think I mentioned it before, but a miswak is just a type of branch where the edges of the branch are made into bristles, into toothbrush bristles, and then the branch is used to clean the teeth. Or do they use a cloth, or do they use nothing? If they use nothing, then please skip to question 11. We do not expect the child to brush their teeth alone before the age of 8. If a parent, caregiver, mother or father or grandparent has to brush their child's teeth until the age of 8. Number 10. Does your child brush their or clean their teeth on their own? We would expect the parent to use a toothbrush or their fingers or a cloth or any form of mechanism to brush the child's teeth. And we want to know whether this question refers to whether the child is brushing their teeth on their own or whether a parent or a caregiver is supervising the toothbrushing. So number 11 is specifically asking whether the parent is supervising the child's brushing of their teeth. Number 12. How many times does the child brush or clean their teeth? Once a day, twice a day, or a few times a day, irrespective of whether a child uses toothpaste or a cloth. If plaque removal occurs daily, is it in the morning or evening can be recorded as once a day. If the caregiver brushes or wipes their child's teeth twice a day, in the morning or afternoon or maybe after meals, it should be recorded as twice a day. Even if it is more than twice a day, if the teeth are brushed every other day or not regularly every other day, then it should be recorded as a few times a week, else it should be recorded as never. Question 13. Do you use toothpaste to clean your child's teeth? Yes or no? This is a particular question on toothpaste usage in children. If question 12 was not recorded as if question 12 was recorded as never, then this question is not answered, irrespective if they use a brush or cloth to clean the child's teeth. The point is if there was toothpaste usage. Question 14. Which of the following will prevent tooth decay? Brushing teeth on a daily basis, not snacking on sweetened foods during the day, using toothpaste, using a face cloth to clean the teeth, drinking water frequently, sleeping with a bottle, placing sugar in a bottle, on-demand feeding, especially at night, and not cleaning your child's mouth. The question 14 is related to the knowledge of the caregiver, and the facilitator should not lead the caregiver to the correct answer. This question is for the adolescent between the ages of 14 and 18. The first question is, do you have limited arm or hand movements? So the reason why we're asking this question is we're trying to determine physical disabilities that may affect either temporarily or permanently a person's physical capacity and or mobility. A reduction is a normal range of motion in any movements of the joints is known as limited range of movement in the hands, movement or the arms. Movement naturally declines as you age, but it can also occur with a number of conditions. It can affect how you hold or grasp a cup, or even how you manage movements such as having a bath or brushing your teeth. There are different causes of physical disabilities, but they can include inherited or genetic disorders, serious illness, and injury. Do you visit the dentist or dental clinic? Yes or no? It is expected that everyone visits the dentist, oral hygienist, dental therapist at least twice a year for a checkup. If answered no, skip to question 7. Question 3. If you answered yes to question 2, how far is the dentist or dental clinic from your home? The distance from the participant's home address to the nearest public dental facility, and the dental public facility could be a remote clinic or their hospital. So we want to know how far away the dentist or dental clinic is from the home of the participant. Question A, option A would be within walking distance to the dentist or dental clinic, and option B would be, do you have to take a car or taxi or bus to get to the dental clinic? Question 4, if you answered yes to question 2, was your dental visit at a government clinic, yes or no? The government clinic can be any clinic where there is a no-fee treatment being offered. Even if it's a mobile facility such as the Falafel train or a free dental facility offered by the dental faculties or the primary healthcare centers at day hospitals. Question 5. If you answered yes to question 2, for what reason did you visit the dental clinic? A, for routine checkups, or B, only when in pain? Routine checkups would be if the participant had no dental pain. So if they just went for polish or cleaning, or if they just wanted to get a general checkup, just every 6 months, everybody in the country should be going for a general checkup. Was the participant seen by a dentist? And then we require the reason for their visit. Question 6. If you answered yes to question 2, when was your last appointment to the dental clinic? Less than 12 months ago? More than a year ago? I do not recall my last dental visit. If the person can't remember seeing a dentist, then it could be marked as I do not recall my last dental visit. Question 7. Do you currently have any decayed or rotten teeth in your mouth? Yes or no? This question is a self-reported assessment on whether the participant has any holes or dark spots on the anterior teeth from eye tooth to eye tooth, which is your canines, in the top jaw, or the back molars, top or bottom. Only one tooth in the whole mouth needs to be observed as decayed or rotten for this question to be answered as yes. Question 8. Do you currently have any braces in your mouth, or yes or no? This question refers to whether a person is wearing an appliance to straighten their teeth. It can also refer to someone wearing an orthodontic plate to straighten their teeth. Any fixed, stuck on your teeth or removable appliance which can be removed when eating to straighten the teeth can be used here. Number 9. What do you use to clean or brush your teeth? Toothbrush, miswak, cloth, or nothing? If answered D, then skip to question 11. Question 10. If you answered yes to question 9, how many times per day do you brush or clean your teeth? Once a day, twice a day, a few times a week? Question 11. Do you use toothpaste to clean or brush your teeth? This is a particular question on toothpaste usage in adolescents. Irrespective if they use a brush or a cloth to clean the teeth, the point is, do they use toothpaste? Question 12. Do you wear denture or false teeth? Yes or no? Question 13. Does your gums bleed on its own? Yes or no? Question 14. Does your gums bleed when you brush your teeth? Yes or no? Question 15. Do you floss your teeth? Yes or no? Question 16. If you answered yes to question 15, do your gums bleed when you floss your teeth? Yes or no? Question 17. Which of the following will prevent tooth decay? So question 17 is related to the knowledge of the participants, and the facilitator should not lead the participants to the correct answer. This is a knowledge question where each yes answer is recorded with 1 point, and the maximum score for question 17 is 5. Please do not lead the facilitators to the correct answer. Which of the following will prevent tooth decay, rotten teeth? Brush teeth on a daily basis, eating a healthy diet, using toothpaste, using a mouthwash, drinking water frequently. This questionnaire 4, is related to adults aged 20 to 59. So the question 1 is, do you visit the dentist or dental clinic, yes or no? If they answered no, then you can skip to question 6. If they answered yes, then you'd answer you'll ask question 2. How far is your dentist or dental clinic from your home? So this refers to the distance between where the participant stays and the access to the nearest dental facility. Question 3, if you answered yes to question 1, was your dental visit at a government clinic? Question 4, if you answered yes to question 1, what was the reason for the dental visit? Question 5. If you answered yes to question 1, when was your last appointment to the dental clinic? Less than 12 months ago, more than a year ago? I do not recall my last dental visit. Do you have any teeth in your mouth? Yes or no? So the purpose of this question is to determine how many people have no teeth in their mouth. If they answered yes to question 6, then they would be asked question 7 and 17 only, and thereafter question 18. So question 7 is, do you wear a denture, false teeth, yes or no? Question 8. Do you currently have any decayed or rotten teeth in their mouth? The question is a self-reported assessment on whether the participant has any holes or dark spots in the anterior or posterior teeth and the top or bottom jaw. Only one decayed tooth in the whole mouth needs to be observed for this question to be answered yes. Question 9. What do you use to clean your teeth? A toothbrush, miswak, cloth, or nothing? If your answer is D, then skip to question 11. If you answered A, B, or C to question 9, how many times per day do you brush or clean your teeth? Once a day, twice a day, or a few times a week? Question 11, do you use toothpaste to brush or clean your teeth? Yes or no? Question 12, does your gums bleed on its own? Yes or no? Question 13, does your gums bleed when you brush or clean your teeth? Do you floss your teeth? No, question 14. Question 15, if you answered yes to question 14, does your gums bleed when you floss your teeth? Yes or no? Question 16, do you have teeth in your mouth that are loose? Loose teeth is a sign of bone loss around the teeth and loss of supporting structure for the tooth. If the participants are able to move their teeth with their fingers or their tongue, or if the teeth move while they are eating, then the answer would be yes. Do you suffer from dry mouth? An example of this would be when somebody has difficulty eating, swallowing, or talking. Less saliva in the mouth means that they have to have frequent sips of water. When eating, they need to suck on sweets all the time to keep the mouth moistened. Question 18. Which of the following will prevent tooth decay? Brushing teeth on a daily basis, not snacking on sweetened foods throughout the day, using toothpaste, using a face cloth to clean your teeth, drinking water frequently. This question is related to the knowledge of the participant, and the facilitator should not lead the participant to the correct answer. This is a knowledge question where each yes answer is scored with 1 point, and the maximum score is 8. Do you visit the dentist or dental clinic? Would be the first question for adults between the ages of 60 and 75. If they answered no to this question, you would skip to question 6. Question 2, if you answered yes to question 1, how far is the dentist or dental clinic from the home? If you answered yes to question 1, was your dental visit at a government clinic? Yes or no? If you answered yes to question 1, what is the reason for your last dental visit to the dental clinic? For a routine checkup or only when pain? If you answered yes to question 1, when was your last appointment to the dental clinic? Less than 12 months ago? More than a year ago? I do not record my last dental visit. Do you have any teeth in your mouth? If you answered no, answer question 7 and 17 only. Question 7 is, do you wear a denture or false teeth? Question 8 is, if you answered no to question 6, do you currently have any decayed, rotten teeth in your mouth? Yes or no? As before, we want to know how many teeth are if they have rotten teeth in their mouth. So they've got to look into their mouth and see if they have any dark brown or black spots. What do you use to clean or brush your teeth? Toothbrush, miswak, cloth, or nothing? If you answered D, then skip to question 11. If you answered A, B, or C to question 9, how many times per day do you brush or clean your teeth? Do you use toothpaste to brush or clean your teeth? Or does your gums bleed on its own? Question 13. Does your gums bleed when you brush or clean your teeth? Do you floss your teeth? If you answered yes to whether you floss your teeth or not, does your gums bleed when you floss your teeth? And number 16 is, do you have any teeth that are loose in your mouth? The teeth that you can move with your tongue or your finger, or teeth that move while you are eating. Number 17, do you suffer from dry mouth? Yes or no? Question 18, which of the following will prevent tooth decay? Brushing teeth on a daily basis, not snacking on sweetened foods throughout the day, using toothpaste, using a face cloth to clean your teeth, or drinking water frequently. We've come to the end of the questionnaire for age group 60 to 75. I'd like to thank you for your attention, and please feel free to let me know if you have any questions. Good luck with the data collection.